am very proud to be the chair of the European region, and I must say, sitting here this morning, listening to the history, which was just fantastic to listen to, and to meet Mrs. Pulis, and these are the people on whose shoulders we stand. We cannot do anything without the people who have gone before us. And it was much harder in the earlier days. I know it's a struggle now, but I think it was much harder when you were really trailblazing the establishment of the profession. And of course, physiotherapy came from Greece and was mentioned by Hippocrates. So it has a very long history, but it was people like Mrs. Poulis and all of the people who were here this morning who have contributed so fantastically to the profession, not only in Greece but in Europe. And I would also just like to add, if I may, that I've recently been appointed to the History Association of Physiotherapy, or the Physiotherapy Association of History. I'm not quite sure what way it works. But I just thought that this history that was presented today was really fantastic, and I would love that we could bring this to the Physiotherapy History Association, because they are looking for histories of physiotherapy organisations. So if I could, with permission, and obviously discussion afterwards, to bring that, this is something that must not just be in the history of Greece, but must be part of the history of physiotherapy. So congratulations. Oh, okay. I haven't. Oh, yeah. Oh, okay.
Just to locate the file name.
This or this?
Oh gosh, this one, the top one. Yes.
Okay.
Thank you. This is for
Okay.
This is for.
Put
Okay.
this
Okay.
back down.
Okay.
Next.
Okay.
Okay.
Okay. Thank you. Thank you so much. So thank you, and thank you for your attention. Pedros has asked me to talk a little bit about the history of the Europe region, and so I'm just going to give a brief overview about that, and very briefly mention education, because President Michael Landry is going to speak on education, and just to speak a little bit on autonomy, and a quick mention for health economics, because it is such an important area for us. I come from the west of Ireland. It's amazing to be here in this city of Athens. I live in a village with 20 houses, no shops, and for Ireland, no pubs. So I cycle down and swim here off the pier on the Atlantic every morning. It's a lot colder than the waters around Greece. So very briefly, this is us in terms of world physiotherapy being established in 1951. We are one of 5 geographical regions. Currently, there are 125 member organisations representing 685,000 physiotherapists. The European region was established in 1998, and it was the combination of 2 organisations, also called a European region, but also the Standing Liaison Committee of Physiotherapy. And Pedros mentioned it today, physiotherapists from Greece were very involved in this. This was established purely to deal with the EU and to work on obviously directives and that pertain to physiotherapy, and to make sure that the EU was aware that physiotherapy existed. It did a lot of great work. And then in 1998, the 2 organisations came together within World Physiotherapy, obviously, for the betterment of physiotherapy in Europe as a whole. And obviously the Pan-Hellenic organisation then joined, and you're celebrating 50 years as a member. So at that time, now I should say, we have 38 member organisations, and we're representing 200,000 physiotherapists. So quite a large, okay. So in the Europe region in 1998, when it began, there were 30 member organisations, and now there are 38 member organisations. So we have grown and continue to grow. Very briefly, just to show you what it is, it's a very democratic organisation. All of the work that we do is determined and approved or rejected by a general meeting, which is a meeting of all of the member organisations within Europe. We have, the general meeting is held every 2 years. We've just had one, as Petros has mentioned, in Riga in Latvia. And we have an executive committee which serves 4-year terms. We have a secretariat based in Brussels, for whom we are very grateful to Aitor Carpio, the General Secretary, and the team for all the work that they do. And then we have these 6 working groups, which I'll speak a little bit more about shortly. Okay, so where have we come in terms of general meetings? So the first one was held in Estoril in Portugal, and we've had all of these since. And as you can see, Athens and Greece and the Pan-Hellenic Association is very prominent there. The general meeting was hosted by the Pan-Hellenic Association in 2008. Okay? And these are the congresses that we've had. In fact, I should say 5 that we've had, and the 6th, which has just been announced, which will be in Madrid in Spain in 2026. I'm not quite sure where the next general meeting will be, but hopefully there will be an announcement about that soon. Okay. Just very briefly about education, and this is a recent piece of work by the region looking at the minimum qualifications, so the entry level to practice across Europe. And I'm sorry I don't have a comparative slide, but I can tell you that now in 2024, this is as it is, and it's much better than it was. So you can see that over nearly 85% of the entry level is a bachelor degree course, and for a small number, increasing number, the entry level is a master's degree. So you here in Greece are in that bachelor's degree group with your 4-year education program in your 5 universities, the standard of which is high, and I urge you, there's no reason why it should go back, but I urge you to maintain that high level of programs. It's a great credit to you. There is one country in which the diploma is still the entry level, but we're working on that to assist. Okay. Looking then at the history of our working groups, in 2004, when they were established, there were 15 working group members from 10 member organisations. So that was a great start, and great work was done, and we've built on that work. And now we have 6 working groups with 32 working group members and 21 member organisations. So we've doubled the number of member organisations in Europe that are involved, and we've also more than doubled the number of working group members. And I again pay tribute to the Pan-Hellenic Association. You've been very active and very involved in this. And in our advocacy and EU matters working group, we are grateful for the work of Lefteris and his contribution. And in education and research, we are very grateful for the work of Nikos in this. So thank you for the part that you play. It's extremely important, and please continue to apply. Okay, so again, just a comparison in terms of where we have come from and where we are today. And I really hope we're just about to make appointments to the next set of working groups for the next term, the 2024-26 term. The closing date is this week. And I'm really hoping that we can increase the number of member organisations who are involved. That obviously has been my aim along to try and increase this. Not going to go in very busy slide, but just to kind of give you some idea of the kind of activity that we're involved in. There are particularly of the working groups who do most of the work, and we are very grateful for that. So they meet 4 times in person in a 2-year term, and then lots of in between online. Okay, they review papers, the sort of past papers, the past documents, to see whether they're still relevant and whether they need to be updated, and they develop new papers. And these are all approved by the member organisations at the general meeting. Okay, so as I say, just gives you an idea. I would like to, I suppose, draw attention to the work that we do with the EU, and I hope the next slide will show that. Yes, over the years we have built up this partnership considerably, and we have memorandums of understanding with various organisations, and we have members who sit on many of these groups within Europe and within the European. Some of them obviously are European Union, some of them are European, but just to give you an idea of the, I suppose, the extent of it. And this has really only happened, I suppose, in the last about 12 years. Okay. This is one example. This is our Memorandum of Understanding with the European Doctors Association, or the Standing Committee, as it's called, of European Doctors. And this was our first memorandum, and it was signed back in 2016 when Sarah Bazin was chair of the European region. And the wonderful thing about this memorandum, and it has been of great help to organisations, is that it respects the autonomy of both professions. So that's I think is a very important step forward in terms of the mutual respect of both organisations of the autonomy of the other. Ooh. Okay, I didn't realise this is one of these slides. I just wanted to show you, we talk about the history. This aspect on the left shows you how convoluted the journey was for the patient to get to physiotherapy. And now, because of our education, because of our autonomy, because of self-referral, it's now on the right from the patient directly to the physiotherapist. So we have come a long way, and thanks to many people who fought for that all along the way. Okay, these are very sad. Oh, sorry, forgot that little bit. Didn't intentionally do it. I've talked many times to the Panhellenic Association about the cost effectiveness and the health economic impact of physiotherapy, and indeed I'm really delighted that you're currently undertaking research yourself in this area to show it for your country, because we now have it for several countries, and I think one of the things we need to do is to bring it together. The big impact of physiotherapy, I think, is in the decrease in admissions, the decrease in readmission rates, the decrease in the length of hospital stay, and the use of prescription medicine. And we have several examples, many examples from the UK, from PhysioWorks. Mike referred to research in America. We have a lot over Europe as well. I think we need to pull this together. And obviously the benefits go without saying. There are benefits for the patients, but there are also benefits for the doctors in lower waiting lists, better use of their specialist time, and obviously for physiotherapists, it's much more satisfying for us. I just want to talk a little bit about autonomy, and this is from the to acknowledge the Advocacy and EU Matters Working Group, of which Left Terrace is a member, but these three members led on this report. So just quickly to show you a little bit about referral and what it's like in Europe. So the question was here, is medical referral required to access physiotherapy services? And it's kind of interesting, you can almost divide Europe into north and south here in terms of these areas. So the blue areas are, it's never required before a physiotherapist can engage with the patient. The green areas are, it is required at all times. And the, I don't know what you call that colour, somewhere between the green and the blue, it's required for specific situations. Teal, thank you, teal. And then is medical, this just shows you, the blue here is showing you the number of member organisations within Europe to which this applies, and the green is the percentage of the organisations in which this applies. So you see again, this is just what I've spoken about, just transferred into numbers. Okay, and then the question comes about a medical referral. I found this kind of interesting, and I think over time we've now changed these, because there are still countries in Europe where it's prescription. So we needed to look at what referral actually meant. Okay, so does the medical referral include a diagnosis? So in 87% of those that need a referral, it did include that. Did the doctor actually name the number of sessions? And a shocking 19 member organisations still require this. On the referral, the treatment type, 17. So these are big numbers, but they are going down. And this is one of the main areas of work that we're working on to improve the autonomy in countries where it doesn't exist. Okay. And then the frequency. So there are some countries where every detail is given by the doctor. But within that, there are some, the physiotherapist does have some, I suppose, I wouldn't say power, but some ability and to manage this, okay? So for instance, the specifics of the treatment and the referral can be adapted by the physiotherapist. So again, 56, so over half of those who need a referral, this can happen. So even if the referral comes in with all of these details, there is an ability, and the physiotherapist is legally allowed to make changes, okay? Where the treatment is the sole responsibility of the physiotherapist, also again about 35% of those. And the treatment can be changed without asking the health professional who did the referral, small number, 7%. Okay, so I think it's really interesting to see this kind of development. So we come from countries where there's no referral is required at all, to where it is required in some, to where it's very specific, but where the physiotherapist is able to change it, either through consultation with the doctor or without. So we have varying degrees of autonomy. This just briefly looks at referrals and where referrals can be made from. So it's the medical doctors and health professionals, obviously in most cases, 67%. The patients can refer themselves, 56%. And others, I think, really refers to, oh, do I need to dance? Okay. All right. And then sometimes there's a difference between the public system and the private system. And in many countries, the referral to private system is self-referral all the way, but in the public, it remains referral from a doctor. So again, you just see high percentages of patients having access to the public health system where a medical referral is needed. Okay. And in some countries we have, for instance, in intensive care, there's a blanket referral for physiotherapy, whereas in some cases it's still on a case-by-case basis. Okay, and then one aspect which I think is a very big issue for us in Europe is about the differences in payment and reimbursement for medical treatment options when a patient is referred. Sometimes there can be a difference in payment, sometimes there can't, it depends. It's very strict in some cases, it's limited to numbers in some cases, and I personally have a concern where it's limited in numbers by the health insurers, because I think that remains with the physiotherapist, and I think we have to be very careful, because I do think that we run the risk of actually coming back to technicians if the health insurers are telling us how many physiotherapy sessions a patient can have. That is the autonomous decision of the physiotherapist based on assessment and treatment and prognosis. So I think it's something we have to be very careful of. And then this is just about physiotherapists permitted to assess and or diagnose the patients. So very often physiotherapists are allowed to assess and treat, but often they're not legally allowed to actually diagnose, to give a physiotherapy diagnosis. So you can see a big difference in the top two and the bottom two. The top two apply to assessment, where we are kind of legally, in most cases, authorised to assess. But when it comes to actually authorisation to diagnose, well, then that drops kind of considerably. So that's something, again, that we have to work on. So moving quickly on in terms of the future, things we have advanced practice here, you mentioned it today, and we really need, I suppose, to develop this. Again, we've a lot of evidence for it in all areas, pediatrics, respiratory, obviously musculoskeletal, but in the other areas as well. And we need to work on this and make sure that physiotherapists are involved in all of these areas, such as joint injection, non-medical prescribing. That is a big one, but it takes a lot of time. In the UK, they have it. It took 12 years to get partial prescribing and a further 6 years to get total prescribing. It's a long journey. But it's great when one country can set it out for us and we can lead. Okay. So in the future, I have to tell you that this is a slide slightly adapted, but that I used when we were celebrating 100 years of physiotherapy in Ireland back in 2005. And I think we've got to keep pushing out the boundaries. Person-centred care remains really the aim of everything that we do. It's got to be evidence-based. We need to use best practice standards and research. It's been mentioned here today. In fact, my mother attended the 1956 World Congress. Leave her out most times, but it just reminds me every time I see research. I found her report, and in 1956, at the bottom of it, she said, a lot of research is needed in physiotherapy. Ooh, 1956, yeah. So it's still the same. We still need, we have a lot more since then, but we still need to continue to show the evidence of our work. So I think we disregard history and experience and indeed politics, as Petros has mentioned, at our peril. We need that history. We can't do it without the history that we've had. I think we must remember the core. We've got to consolidate our core of musculoskeletal, respiratory and neurology. They are the core areas of physiotherapy, but we've got to push out the boundaries and we've got to continue to do that, to continue to all of the people here today who have been the pioneers, and to the young people who are coming up behind, the students. You're going to be the pioneers. We're depending on you to improve our profession. It's very much in your hands. I will say to you, reach for the stars, the sky is the limit. And to remember, in terms of your organization and the Pan-Hellenic Association, that an organization is as good as its members. So you need to be part of it. It's really important. And sometimes I think if you're students and just beginning, you wonder about it. I'm telling you, as old as I am, you need to be part of it from the beginning and get in there and get involved. And once more, congratulations to the organisation on its 50th and 60th anniversary, and it's a pleasure to be here. Thank you.